Former US President Joe Biden has thanked well-wishers for their support after revealing he's been diagnosed with prostate cancer that has spread to his bones. According to a statement, the diagnosis was made on Friday after the 82-year-old saw a doctor last week for urinary symptoms. Biden, who left office in January, is now undergoing further evaluation and treatment planning. For more on this, I'm joined by oncologist and president of Atossa Therapeutics, Dr. Stephen Quay. It's an absolute pleasure to have you on the show, Dr. Stephen. Thank you for joining us. So I just said there, Joe...
Happy to be here.
Great to have you. Joe Biden has been diagnosed with an extremely aggressive form of prostate cancer. And it said that this was diagnosed recently. Why was this not diagnosed any earlier?
Well, I think, in medical school, they tell you when you hear hoofbeats, think of horses, not zebras. So there are some very rare cancers that could operate as fast as this did. But the 98% probability is that this was known at the time of his physical last July and wasn't revealed. It's simply not credible to have cancer be in your bones 13 months after having any sort of prostate examination. The prostate cancers that do not produce a PSA, which is the blood test, also are not hormone sensitive. So we're told that this cancer is hormone sensitive. So it rules out the 2% of cancers that wouldn't be detected by a blood test. So I think in all likelihood, he has known that he has had prostate cancer for about a year. Now, I've gone further, and I'm certainly speculating here, but the treatment for prostate cancer of this type is something called ADT, androgen deprivation therapy. And the two major side effects are cognitive decline and falling down. You lose skeletal muscle, and about 37% of all men will fall down during the first year of treatment there. So now I'm beginning to wonder whether perhaps he was under prostate cancer treatment in the last year, and some of the things we saw on camera were the side effects of that treatment.
Doctor, you've just basically answered the second question I was going to talk to you about, because Joe Biden's health has been under the spotlight and really intense scrutiny, especially his cognitive ability. So, as you said, do you think that this diagnosis could explain some of the former president's behavior that we have seen? And we also know he dropped out of that election race quite late on.
Yes, I think, and I'm being specific about the fact that the treatment for metastatic prostate cancer has side effects that include cognitive decline. It's not the cancer itself that would necessarily cause cognitive decline, but I suspect it was known that he had pretty advanced cancer. The treatment would have been put in place, and then some of the falling and some of the cognitive decline would be attributable to that. There could be multiple causes of the cognition even before the prostate cancer, but this level of metastatic disease is probably a 5 to 7 year process.
Potential treatment and next steps have been revealed. Hormone therapy has been suggested. How effective is this in helping what Joe Biden has been diagnosed with?
Yeah. So for your viewers who, many of the men will eventually have prostate cancer. It's the most common cancer in men. So the treatment for hormone-sensitive cancer is really good for 2 to 3 years, and it absolutely stops the disease from progressing. But Darwin sort of raises his head, and the tumor evolves to be independent of testosterone, and then it starts to grow again. The treatment no longer works. You're then in the chemotherapy zone, which is a little harsher, a lot harder to take. But, for an 82-year-old man, I think this will be part of his final chapter, but may not be the final endpoint.
And just for everyone watching and the men out there that you just said to yourself, how easy is it to diagnose prostate cancer?
Well, you can get into the high triage area very quickly. A blood test for something called PSA and a digital rectal exam to feel the prostate through the rectum. Those two tests will find 95% of all cancers. They will also find some inflammation or infections or just benign prostate enlargement. So you do have further diagnostic tests. But to end up with metastatic cancer in your bones. You usually see that in clinics where people don't have insurance and they show up in the emergency room. So that this is not a finding for a presidential, for a person who has been a president for 4 years, a vice president, a senator. It's just not credible that this wasn't known.
And King Charles has actually written to Joe Biden after his cancer diagnosis. And for you and yourself as a doctor, how important is it that such high-profile figures are discussing their personal journeys with cancer?
Well, I think it's a good. I mean, 40, 50 years ago, cancer wasn't mentioned. Sometimes you would talk to the relatives and not the patient about it. But we've come a very long way now, and I think men are a little more reluctant to talk about their health than women. So I think it is good. As I said, prostate cancer, lung cancer are the two major cancers in men, and prostate cancer is so treatable if you get it locally. 95, 97% 5-year survival if you catch it when it's in the prostate. But it goes from the prostate to around the prostate in the pelvis and then into the bone. So it's a two-step process. That's why this is so late for President Biden. But look, if you're 50, you should have a PSA test. And if you've had some family history of prostate cancer, maybe 45. And then you can track it over time.
Well, that's really a good news for everybody out there who's watching to take those steps, especially at that age. But I just want to clarify one final thing with you, Doctor. According to a statement, I'm just going to say it once again, the diagnosis was made on Friday after Joe Biden saw the doctor last week for urinary symptoms. But you do think that this is a surprise diagnosis and it was possibly known by the president even when he was in the White House?
Yes, again, for 98% of prostate cancers that are metastatic last week in the bones, they were easily diagnosed July of 2024, diagnosed in 23, 22, 2019. So yes, it would be malpractice not to know that he had prostate cancer. That was progressing over the last 5 to 7 years. So, we all have medical privacy rights, I think, although maybe the president has some further obligations to be president of the United States. That's a political question.
Yeah, no, absolutely. But I just wanted to say thank you so much for joining us, oncologist and president of Atossa Therapeutics, Dr. Stephen Quay. I much appreciate your time this evening. Thank you once again.
Thank you. It's a pleasure to be here.